Good evening, ladies and gentlemen, my distinguished panelists, and all the viewers. I am Dr. Nishant Sharma, your moderator for the evening, and I welcome you on the series of virtual discussion on arthritis in India, a national-wide dialogue. This series is a joint initiative by Voice of Healthcare and Pfizer, where we will talk about the different scopes and spaces of arthritis and its care in India. We will be discussing about arthritis, different types of arthritis, its management strategies, advancements that we are seeing in the nowadays on the treatment space, and strategies for improving its care. I am very honored to welcome my experts from Kolkata. Allow me to introduce my panelists. We have with us Dr. Chinmay Nath, consultant orthopedic and spine surgeon at Apollo Multispecialty Hospital, Kolkata. Good evening, Dr. Nath. Thank you for joining us.
Good evening.
Thank you. We have with us Dr. Anindya Basu. He's a spine surgeon at the Institute of Neurosciences, Kolkata. Good evening, Dr. Basu.
Good evening, everyone. Pleasure to join with you.
Thank you. Thank you. And we have Dr. Ritwik Ganguly, who is professor of orthopedics at KPC Medical College and Hospital and a senior consultant arthroscopy and joint replacement surgery. Good evening, Dr. Ganguly. Thank you for joining us.
Good evening.
Yes. So without further ado, let's all delve into the conversation that we'll be doing. So we'll have broad topics. So to start with, I'll start with Dr. Chinmay Nath. Dr. Nath, let's start by understanding what is arthritis and what are the different types of arthritis that we see prevalent in India. Please.
The arthritis term is actually common. What your understanding and our understanding is that it may be inflammation, or in arthritis, if it is itis, then it is either infection or inflammation. But commonly, the common type of arthritis, that is osteoarthritis, that is not actually arthritis, that is arthrosis. Okay, that is a degenerative sort of thing. And all other things where there is either inflammation or infection of the joint, that may be true arthritis. Okay. Hope I am able to make you understand my
Right, sir,
point.
please. Yes.
So there are different types of arthritis. First is infective. It may be pyogenic infection. It may be granulomatous infection, like tuberculosis in our country. That is not very common. Pyogenic infection is commoner in young individual and very old debilitating and immunocompromised. Tuberculosis arthritis in our country, in the long and in the major joint and smaller joints, maybe common in all the age groups across the population in our country. There are other types of arthritis, like inflammatory arthritis, like maybe rheumatoid arthritis, which is actually true inflammation. It is immunological sort of thing, and this is there are other type of inflammatory arthritis, like psoriatic arthritis, like Raynaud's disease, and sometimes in ankylosing spondylitis. There are also inflammatory arthritis in other big joints. So these are the inflammatory arthritis, and a big number of arthritis affects the middle-aged and older population. That is not actually arthritis, that is arthrosis. So there are some inflammation along with the degeneration. So these are, in this case, disease, there is degeneration, erosion, age-related change in the cartilage, damage to the cartilage, and also along with that there is some pannus formation, just like in granulomatous chronic arthritis. So there is side by side inflammation, a bit inflammation, and mostly degeneration. So this is called osteoarthrosis actually.
Okay.
So broadly,
Thank
these
you.
are the arthritis.
Yes, thank you. Thank you, Dr. Nath, for this wonderful introduction to what arthritis is. Moving over, my question will be for Dr. Ganguly. I hope you're there, sir. Yes.
Yes, yes,
Yes.
yes.
Hi, Dr. Ganguly. So, as we were discussing with Dr. Nath, moving that conversation further, I'd like you to put some light on the common symptoms and signs of arthritis that we see, and are there any key risk factors that are associated around arthritis? Over to you, sir.
So the causes of arthritis has been briefly enumerated by Dr. Chinmay, Nath. And the symptoms are the main symptoms of arthritis or arthrosis is mainly pain. So mostly the patient presents with joint pain. Initially, these are the painless process. As the disease progress, and there is involvement of the subchondral bone. So when the arthritis is advanced, some sort of advancement and some sort of cartilage degeneration, the subchondral bone is exposed, then the pain starts, and the pain is gradually increasing. Most of the cases, it is basically the rapid in nature in case of inflammatory arthritis like rheumatoid arthritis or any other connective tissue disease. But the degenerative arthritis, the pain is there is a wax and wane of the pain, and there is associated symptoms like stiffness, and as the pain increases, the stiffness increases generally, but it has to be differentiated from the stiffness of inflammatory arthritis. So inflammatory arthritis causes stiffness mainly in the morning. So morning stiffness is common in inflammatory arthritis, and so apart from that, there will be deformity in the advanced stages of the arthritis, which involves the knee joint mainly. There are different types of deformity. We can see the varus deformity, which is common in advanced osteoarthritis of the knee joint. But whenever the osteoarthritis or the osteoarthrosis is due to the rheumatoid arthritis, it involves a knee joint, then the other kind of deformity like valgus deformity we can see. So generally the symptoms are maybe the pain, some sort of swelling along with associated with the pain. Apart from there's a stiffness and the deformity. So all these things are gradually progressive, and we have to differentiate between the all causes of the arthritis, all causes of the joint pain, and diagnose accordingly.
Thank you, Dr. Ganguly, for putting light on the common symptoms. Moving on to the same part of the questions, any key risk factors that are associated with the arthritis condition, Dr. Ganguly?
Yes. So there are different risk factors. There are modifiable and non-modifiable risk factors. Definitely, like any other disease, chronic disease like other medical diseases. So for knee osteoarthritis, which is common, or the osteoarthritis of the hip joint, the most important is the lifestyle. So lifestyle, the individual works, how the individual sits or works is important. Then apart from that, any history of previous trauma, whether it is present, if it is present, it leads to the rapid osteoarthritis. If there is any previous trauma causes ligament or cartilage damage or meniscus injury, and if it was untreated or untreated, then it will progress to advanced osteoarthritis. The other causes are basically the increased body weight is important factor. Other metabolic disease
Dr. Ganguly, we just lost your voice. You're inaudible, unfortunately. We aren't able to hear you, Dr. Ganguly. Dr. Ganguly, you're not audible. I'll move on and I'll circle back to you in a second. Moving over, Dr. Basu, my next question is for
Yes.
you. Being a spinal specialist, uh, how do you see the impact of early diagnosis on the overall treatment outcome for individuals with, let's say, osteoarthritis or some other form of arthritis, according to your clinical practice? Please.
Right. So, like arthritis also involves joint of the systemic arthrosis or arthritis, which involves all the joints of the body, and spine is not spared either. So, like yeah, some of the arthritis, like rheumatoid arthritis, is a very common inflammatory arthritis that is genetically determined, and that runs sometimes in families, or has got connections, has got hereditary bearing as well. So in those situations, you can see that the spine can be affected. For example, the cervical spine can be affected, which can this rheumatoid arthritis can give rise to instability of the C1, C2 joints as well as the subaxial spine. It can give rise to instability of the lumbar spine as well at times. So these, the arthritis does have some kinds of arthritis do have their impact on the spinal health as well. And apart from that, there are certain arthritis, uh, like uh, one of the arthritis called ankylosing spondylitis. It's a form of arthritis in which there is bone formation of the soft tissues, and the all the joints of the body stiffen up.
Okay.
So in that arthritis, we normally see the spine becomes very stiff. It loses flexibility. Sometimes become deformed in the form of kyphosis. Kyphosis is a deformity in which the patient leans forward. There is fixed deformity of the neck at times, or of the back. So the patient leans forward, loses the balance to stand or to look forward. So these kind of arthritis can have impact on the spinal health as well.
Right. Thank you, Dr. Basu, for putting some light on it. So we have clinicians with us. I'd like to start again with Dr. Chinmay, where I would like to ask the question about how does a clinician come to the diagnosis of arthritis? Dr. Chinmay, please. Hi, Dr. Chinmay. Are we audible to you?
Yes.
Yes,
No,
sir.
please repeat
Shall
again
I
because
repeat my question?
yeah, because I had a call.
Yes. So I was asking, being a clinician and having all these clinicians with us on this panel, we are trying to understand about arthritis. So my question to you is, tell us about the different diagnostic methods used and the different timelines that you follow while making a diagnosis for arthritis, let's say.
Yeah. The first thing is uh, clinically, we should examine the patient clinically and give more time to reach to a provisional diagnosis by clinical methods. And first, from the history taking, if the patient is having joint pain and the patient is younger and female, then and it is a polyarthritis or polyarthralgia, that means pain in different types of joints, multiple joints. Then we may suspect that some sort of polyarthritis, even rheumatoid arthritis is one of them. And the variation of the arthritis and the relation with the rest and work. If there is pain which is mostly at morning after rest of overnight rest, then it is likely to be an inflammatory arthritis, just like rheumatoid arthritis. If or sometimes ankylosing spondylitis. If the patient is feeling pain after exertion, after work, at the end of the day, more pain at the end of the day, then it may be osteoarthritis, okay, osteoarthrosis. And if there is pain along with fever, along with other signs of inflammation like redness, etc., around the joint, and it is duration is very short, then it may be and especially if the age of the patient is very young or very old and immunocompromised, just like diabetic having a steroid for a long time, then we can suspect that it may be an of pyogenic arthritis. And if there is swelling of the joint and um, loss of appetite, um, the pain is increased at night during sleep, and there is weight loss, there is evening rise of temperature, then in our country especially, we can suspect there, and it is a mono or sometimes poly, mostly monoarthritis, that means involvement of one joint. Then we can suspect it a tuberculous arthritis. And if the patient is middle aged and old, and the patient is having pain in one of the wide bearing joints, less like knee or sometimes in hip and ankle, mostly in the knee in our country, and the patient is middle aged and the patient is having pain, less pain at morning, more pain at evening after doing work, daily work, then it may be a case of osteoarthritis. Then we can, after doing clinical examination, if there is a lot of inflammation in different joints, younger patient, or middle-aged patient is female, then we can suspect inflammatory arthritis. Then we uh, ask for investigations like lab investigations, um, total count, ESR, C-reactive protein, then rheumatoid factor, anti-CCP like anti-citrulinated peptide to diagnose whether it is an inflammatory arthritis or not, or anti-nuclear factor, etc., etc. Along with that, uh, 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 we have to, if we suspect that it's an inflammatory arthritis, then we can get X-ray of that, radiological investigation like X-ray of that joint, and also if there is rheumatoid arthritis, X-ray of the both hands, and if there is, along with neck pain, etc. What Dr. Anindya Basu told is very common in rheumatoid arthritis. There is involvement of the cervical spine, so we should get an X-ray of the cervical spine as well. Sometimes more radiological investigations like MRI, if the spine is involved, may be required. But mostly these are the investigation, early common investigation.
Thank you, Dr. Chinmay. Moving over, now that we have discussed about diagnosis, let's talk about arthritic management strategies. So my question to start with will be for Dr. Ganguly. Dr. Ganguly, I hope we are audible to you.
Yes, yes.
Yes, sir. Could you share some light on some effective strategies for managing patients with arthritis? Let's say all the medical, the surgical, the lifestyle approaches that you deploy in your clinical practice for arthritic patients. Over to you, Dr. Ganguly.
Yeah, thank you. So the arthritic management is basically is categorized. Some are medical managements. Among the medical managements, there is some lifestyle modification along with some medicines and surgical management. Apart from that, the most important part of this arthritis, which is common like degenerative arthritis, is the lifestyle modification, which as I have mentioned previously. So this reduce weight, dietary modification is also important. And whenever the arthritis is due to any cause like any connective tissue disease like rheumatoid arthritis or ACL or maybe the Young's pond, uh, then that initial stage the treatment is medical treatment and to
Okay.
control the process. So there are different drugs is available in the market for the control of the disease process, and this drugs has to be given along with we have to see the parameters of the disease activity to see the whether the parameters are reducing or not along with the patient symptoms. So if the patient symptoms are reducing along with the parameters like the CRP, RA factor, or the anti-CCP in case of rheumatoid arthritis is reducing, then the disease is generally controlling. Then the chances of the deformity progression or the osteoarthritis progression is less. So this is the one part. So there are different medical treatment available which was previously used like DMARDs, disease modifying rheumatoid arthritis drugs which was previously used. Now the newer molecules coming up, like the there are different immunological modulators which are available, which are given generally. So these are good effect in long term prognosis and so
Dr.
this
Ganguly,
is
yes, your voice
yes.
is just back. Please continue, sir.
Yes. So this is a part, and if the patient having the ankylosing spondylosis, the same thing, the activity will improve the disease process along with some immunological agents which is recently being used. So in case of ankylosing spondylosis, the spine is affected. So the treatment of the spine, along with the the major joints like hip is commonly affected in case of should be undertaken simultaneously.
Mm-hmm.
So if the patient having entered the end stage of the disease process, in case of Angspont or in case of rheumatoid arthritis, then the treatment is the total joint replacement. It is a very successful surgery. Is the most successful surgery in the recent century, because it not only gives the pain relief, it reduces reduces the deformity, it improves the mobility, and all the parameters are generally becomes normal gradually.
Mm-hmm.
Next, next is coming. Uh, Next is coming to this osteoarthritis.
Right, sir.
In osteoarthritis, there are different stages for osteoarthritis.
Dr. Ganguly, you just went on mute.
Oh, sorry, sir. So
Yeah.
first stage is basically the early stage, the stage 1 and stage 2, and in this stage, the lifestyle modification, exercises, braces, some sort of physiotherapy, and medicine will help. But
Mm-hmm.
whenever the patient starts developing deformity, then deformity correction is very important. Suppose in case of stage 3, whenever it is not completely lost, or the stage 2, when there is a deformity like varus deformity, then in that cases, if the patient age is very young, then we can salvage the joint by doing some surgery, some osteotomies, which will distribute the load across the joint. So commonly done procedure is the high tibial osteotomy. It is done in case of the varus deformity of the knee. It unloads the medial compartment of the joint, and it slow down the progression of the disease of the osteoarthritis.
Right.
So, so this is a very important process, important aspect to see. So, joint preservation approach, preserving approach, and joint replacement approach. So, if the patient's age is young patient, young active, the athlete patients, and the patient having this sort of arthritis or some cartilage damage at the earlier age group, it may be due to the sports, it may be due to the accident, then the patient's approach should be individualized. Like if the patient having the cartilage loss at some part of the articular area, then cartilage loss has been dealt with the different procedures, like the cartilage transplantation, the osteochondral graft is available, is available now in the market.
Right.
So
Thank you,
so
Dr. Ganguly, for elaborating on the different treatment modalities that are available. Moving over, my question will be for Dr. Basu here.
Yes.
Dr. Basu, being a spinal surgeon, what are your views on the recent advancements or the innovative treatments that we are seeing in arthritic management?
Yeah. So the recent advancements, obviously, as Dr. Ganguly said, is the disease modifying agents. You know,
Mm-hmm.
uh, the if you have an inflammatory arthritis, then the best thing to do is to control the disease
Okay.
activity. That is the primary thing to do. So what I do is, being a spine surgeon from orthopedic background, or like spine specialist, if I have a patient with an active inflammatory disease, I immediately refer the patient to a rheumatologist,
Okay.
because a complete rheumatological workup is absolutely essential, and to identification of the disease activity is essential, and one has to carefully evaluate whether the patient fits for the criteria for giving disease modifying agents, so that we can
Hmm.
stop the progression of the disease, because that
Right.
is the paramount thing in treatment, in preventing further progression of the disease, further deformities, further disability, and
Right.
you can prevent lot of complications of these inflammatory arthritis by
Hmm.
giving these modifying drugs at the right time.
So,
So, for
building on what
example,
you
if
are saying,
somebody,
Dr. Basu, put some emphasis on what early diagnosis can actually help a patient for who can be suffering from arthritis. While you are saying, build on that as well. Talk about the early diagnosis, like you were just saying, it can change a lot of things if given at the right
yeah.
time. Over to you.
Hmm. So yeah, obviously, as I was saying, like for example, there are two common arthritis that we normally see. One is the rheumatoid arthritis, another is the ankylosing spondylitis.
Hmm.
Rheumatoid arthritis can affect the knee, can affect the hip, can affect the hands, can affect the spine. So all the can lead to deformity of all these places. In hip, it can lead to severe arthritis, limiting the
Hmm.
patient's ability to walk. Tremendous groin pain when the patient walks. In the knee, it can lead to deformities like valgus deformities, subluxations, and severe pain while walking. In spine, it can lead to subluxations, neurological symptoms. It can even lead to quadriparesis, like weakness of all four limbs. So,
Hmm.
all these things can happen if we don't treat the disease, if you don't do a early diagnosis and don't halt the progression of the disease. So if you do an early diagnosis in a young patient with rheumatoid arthritis and treat the disease activity properly, then we can prevent all these deformities from happening, and the patient can can have a normal life if the patient's disease activity is controlled with medications.
Right. Thank you, Dr. Basu, on describing about the different parameters here. Moving over, now that we have discussed about the diagnosis, about the management strategies, let's talk about patients living with arthritis. So my next question will be for Dr. Chinmay. Dr. Chinmay, I hope I'm audible to you.
Yeah, yeah.
Yes, sir. So my question for you will be suggest some coping strategies that you have recommended or you use for individuals to effectively manage arthritis in their day-to-day lives.
See, both the inflammatory sort of arthritis, means rheumatoid arthritis and ankylosing spondylitis, these are um, autoimmune diseases, and this is familial, and it is inherited, and it does not subside with it may subside, but tendency to develop it over again when the disease activity is high, and if
Mhm.
the patient does not follow the disease modifying agents, anti-inflammatory medicines, and lifestyles. In case of osteoarthritis, if the degenerative process goes on with the advancing age, so actually we cannot cure the disease with the either medications or other strategies, but so the patient has to uh, live with both the kind of arthritis. But
Mhm.
with the modern treatment strategies, either medical or surgical, in case of inflammatory arthritis, if the DMRD works, or if it does not work, sometimes biologics, the infliximab, rituximab, etc., more advanced medicines are available in the market, and they can control the excessive inflammation in case of autoimmune background. Okay, and there are even if both these two does not work, steroids also have an enormous role. Common people think that steroid is a very bad drug, it has a lot of side effects, but if can be if it is used judiciously, it can control severe inflammation. Okay. In case of osteoarthrosis, if it is controlled by medication, by exercise, by lifestyle modification, by relieving the weight, and sometimes joint preserving surgery like high tibial osteotomy or the cartilage transfer, cartilage transplant, these are the modern surgeries. The patient can have a decent life with some restrictions. They should follow all the medications. They should visit their doctors and the physiotherapists and caregivers frequently. They should not lose the follow up, and then they should try to relieve the body weight, reduce the body weight by visiting their dietitian and follow their strict diet, so that they do not put on weight and reduce the weight. And also they should refrain from some activities like squatting, like sitting on floor, which is our Asian habits or Indian habits, and
Right.
use the commodes at the toilets. That is very important. During prayer, they should not sit on floor, and also during eating, they should sit on chair and table and work on chair and table, and they take some rest. In during if case there is ankylosing spondylitis, there is inflammatory arthritis type of thing, it is an autoimmune disease, and they should not take much rest. In that case, the reverse, they should not take much rest. They should do mobility exercises, so that there is no or prevent fusion of the joints, which affects their day-to-day life. And these type of modifications, along with the medication, I don't utter the word only modification along with the medicines, along with the exercise and physiotherapy, and frequent visit to their doctors, physiotherapists, dietitians, caregivers. It is a multidisciplinary approach. So if the
Right.
patient is still in the treatment along with their modification in the daily life, they can live a decent life, if not normal.
Right. Thank you, Dr. Chinmay, for that good elaborative answer on the measures for coping up. Moving over, Dr. Ganguly, firstly, if you'd like to add something to what Dr. Chinmay just commented, any of your suggested coping strategies that you have used in your clinical practice for managing arthritic patients for their day to day?
Yes. So the thing is that it has been broadly discussed about the managing strategies. Most of the cases, this osteoarthritis is managed conservatively if it starts in the early age group, and the patients itself is intent to get it right or get it cured is more important. Then because lifestyle modification is a more important role than any other drugs. Drugs are there, they are in the market, but these are initial part. They reduce the inflammation, they reduce the synovitis or sort of pain and inflammation. But actually, that as the disease is gradually progressive, so the disease has is transferred from, there is a grade 1 to grade 2 and grade 2 to grade 3, and ultimately the advance. So as the disease is gradually progressive, the the lifestyle and the medication is just to slow the process of these activities
Progression. Right.
and the progression.
Right.
So these counseling of the patient is of most important, because the most patient think that in the degenerative osteoarthritis in the early stage they will recover fully. Sometimes they recover fully in degenerative process if the other things are corrected, but mostly they are progressed. This is not in like scenario like rheumatoid arthritis. This inflammatory arthritis, if it is treated by the rheumatologist by appropriate medication, and sometimes of the inflammation of the knee joint. Suppose a RA patient comes with the inflamed knee joint in early age group without any advanced advanced radiological feature, then other sorts of clinical therapy, other sorts of clinical management like aspiration, sometimes
Mm-hmm.
though we seldom practice, this intraarticular corticosteroid injection may be attempted, but it has some sort of side effect, but it should have tried one or twice kind of thing. And if there is a deformity, which as I have already told, the deformity correction is very important to slow the disease process, and gradually the disease process is reduced. And if the osteoarthritis is associated with uh, any other injury around the knee joints, as example, if the patient having the ligament injury like ACL tear, or some
Mm-hmm.
meniscus tear, like this commonly there's a bucket handle tear. So this combo can cause a quick transformation of a good knee to a bad knee, a bad shaped osteoarthritis in a very short span of time. So these things should be treated surgically as early as possible, because the
Mm-hmm.
meniscus repair in early age group is very important. Previously, meniscectomy, either total or sometimes partial meniscectomy has been done, but meniscal preservation has found a role in uh, in protecting the knee articular cartilage. So knee has to be stable with the arthroscopic reconstruction with meniscus procedure. The knee, we can prevent the knee to become arthritic at the earlier age group. So that the thing is that not only the osteoarthritis, but there are various other causes of this osteoarthritis, and we have to, as a clinician, we have to sort the causes. We have to think for which the arthritis is going on or progressing, and we have to treat the process accordingly.
Yes, thank you, Dr. Ganguly, for that elaborative understanding. Moving over, let's talk about some regional insights and some variations that we see in the arthritis prevalence. So my question will be for Dr. Chinmay. As we know that there are some notable regional variations that we see in arthritis prevalence, as well as socio-economic variations that we see. What are your views, and how do you feel that this actually impacts the healthcare delivery that we see in India about the different prevalences of arthritis that we see? Over to you, Dr. Chinmay.
Here, actually, I could not hear because of your question, because of
Okay,
network
okay.
issue. So,
Am I audible now, sir?
please
Is it
repeat it
better?
1 second. Yeah, now is better. Now
Yes.
it is better.
So I was keen to ask you about your views on the different variations that we see in arthritic prevalence in India, depending on age, depending on socio-economic group, depending on demographic, and how do you feel that these variations along the different age groups or along the different patients across India, how does this impact the
Yeah.
healthcare delivery
Yeah.
that we see for arthritis? Please.
Yeah, India is a multicultural, multi-ethnic country, and the population is very big. It is very difficult to define it, the whole population of India in a fixed set of ideas. Okay, say for instance, the dietary habit from in the north, the east, west, and also south are completely different. But
Mm-hmm.
still, we have to formulate a guideline, and we have to formulate how to a guideline how to cope with the arthritis. So that is why we have to assess the demography uh, regarding the age, regarding the ethnicity, and etc. etc. So first, we have to talk about the age. The inflammatory arthritis, like rheumatoid arthritis, like ankylosing spondylitis, these type of arthritis affects mostly the younger individuals. maybe the age group maybe 20 to 40 years or 45 years. These disease activity, even if it is affects a person at the age of a lady affected by rheumatoid arthritis at the age of 30 years, at the age of 60 to 65 years, when she reaches 60 or 65 years, even if even if there is the sequelae of the disease, maybe some deformity or destruction of the joints, but the actual disease activity, inflammatory activity, wanes down, okay, at the advancing age. But the osteoarthritis, in contrary, the disease activity increases with the advancing age. It does not affect the younger individuals. Okay, so even if there is deformity at the age of, say for instance, 80 years, the demand of the physical demand of the person at 80 years, it is not similar to a person having physical of having age of 40 years. So at 40-year old, who is very active, um, both socially, both economically,
Right.
and these type of individuals, if affected, then it is a great loss to the society. But a patient who is affected by arthritis at the age of 85 years, it is not, it is, we have to take care of that individual. We have to try to reduce the disease activity, but the economical burden a bit less, because this 80-year-old person is not economically active. Okay, so that is why we do not have a lot of loss of workforce. So that is why, if the disease activities which are the type of disease, the inflammatory arthritis, which affects the younger individual, that has a greater impact on the socio-economic aspect of the country, rather than osteoarthritis. And with the advancing age, at the I'm telling you one important fact, that during independence, our um, age of the uh, average life expectancy of the Indian population was mere 45 years.
Mm-hmm.
Can you imagine? Right now, the life
Yes.
expectancy is about 70 years. So some people
Right.
lives up to 100 years. Okay. So
Right.
after 50 or after 55, they are affected by osteoarthritis. If they live by 90 years, then they have to deal with this disease for 30 to 35 years or 40 years.
Right.
So during that time, they may have some deformity. So there are a lot of uh, geriatric issues coming up
Mm-hmm.
with the advent of the days, and as the medicine is advancing, protecting the people from dying. So they have the geriatric problems like osteoarthritis of the knee with deformity. So they have to get a replacement of the joint. That is a costly surgery. Sometimes they have to take a lot of case of inflammatory arthritis. They have to take those DMRDs, the disease modifying agents, and biologics, which is very expensive for quite a long duration, maybe 20 years, maybe 15 years. So this is also a big economic burden to the society. So with the advancing age, both the inflammatory arthritis as well as the osteoarthritis, they have a bigger impact on the society.
Thank you. Thank you, Dr. Chinmay, for that wonderful answer. Building on the same thing, my next question will be for Dr. Ganguly. In continuation of the question for Dr. Chinmay, Dr. Ganguly, what do you feel are some specific challenges or barriers that exist in certain regions of India when it comes to providing quality arthritic care, in your opinion?
Yes. So the care is should be holistic care,
Mm-hmm.
as the disease affect mostly the elderly age group. So there are lots of issue, like patient are suffering from, most of the patient are suffering from the eyesight problem. The patient
Mm-hmm.
having some sort of reduced vision. It may be due to the cataract, and some patients having this the neurological issue like Parkinson's. Okay, so the due to that there is and after as the age progresses, so there is a chance of more osteoporosis and the brittle bones.
Mm-hmm.
And osteoarthritis causes reduced movement and pain. So these things has to be dealt with whenever we are taking care of a elderly patient with osteoarthritis. So the approach should be we should treat or correct or reduce the each and every modality. Uh, okay, so for that, the treatment of the osteoporosis is also very important. The
Mm-hmm.
most of the treatment is medical treatment. The exercises is a very important role. Diet is a very important role in
Mm-hmm.
that, because most of the patient are elderly patient, and elderly having very less protein intake.
Right.
Uh, Specifically, it is seen in Bengali after widow. We have seen lots of patient are has devoid of the protein diet after getting widow. So
Mm-hmm.
that causes the bone to become brittle and osteoporotic, and this causes the pain. Apart from the pain, that increases the fracture. So diet supplementation, the adequate balanced diet, along with the adequate intake of calcium, vitamin D3, the other sources of vitamin D3, the from apart from diet like sunlight exposure, is also very important.
Okay. Thank you. Thank you, Dr. Ganguly, for that answer. Uh, Now, let's talk about certain preventive measures and the public health initiatives that are out there for arthritic awareness. So, I'll start with Dr. Chinmay. Dr. Chinmay, please put some light on some preventive measures that individuals can take to reduce their incidence of developing arthritis, if there are any. Please.
There are which can reduce the effect of arthritis. It is very
Mm-hmm.
difficult to prevent the inflammatory arthritis, which is mostly genetically determined, mostly autoimmune sort of things like in rheumatoid arthritis, in ankylosing spondylitis. If you have that gene, if the individual have that gene, then he or she eventually at certain age it will the
Okay.
disease will reveal itself. Okay,
Right.
but with the lifestyle modification, with the proper care, following advice of the medical team like doctors, physiotherapists, dietitians, and if they take care themselves, uh, then, and if they are very aware, then the bad effects like deformity of the joints,
Mhm.
the neurological complications, especially in the if the involvement of the neck by rheumatoid arthritis and other areas of the spine, in case of ankylosing spondylitis. If there is less deformity by awareness, taking medicines, lifestyle modification, frequently visit doctors, doing exercise, then the activity of the disease, even if the disease is there, of the disease or the deformity and active is can be prevented. Activity of daily living can become near normal. In case of osteoarthritis, if the patient or population is aware, especially in case of early arthritis, grade 1 arthritis, when there is no deformity, no bony destruction, if they are aware
Mhm.
that we have to do exercises, we have to take medicines regularly, we have to treat osteoporosis, we have to reduce our body weight, we have to follow some lifestyle changes, like we will not sit on floor, we will not sit cross-legged, we will not stress our joints during prayers and other daily activities,
Mhm.
and especially ladies, they tend to sit on floor during working, especially in our rural population. So then the complications from the osteoarthritis can be prevented, the deformity can be prevented, so they can live a
Mhm.
near normal life even if the disease is there.
Right.
So this awareness is very important.
Okay. Thank you, Dr. Chinmay, for that answer. Talking about some public health initiatives, my next question is for Dr. Ganguly. In your experience, in your practice, do you feel are there any ongoing public health initiatives which are focused on arthritis awareness and prevention, and also for providing support to some arthritic patients and their families? Talking about support groups and public health awareness groups. Dr. Ganguly, over to you.
Yeah, so there should be a government awareness program for this arthritis process. Generally, as organization from West Bengal, the WBOA, the West Bengal Orthopaedic Association, we are doing the Bone and Joint Day,
Mm-hmm.
and this is each and every year we celebrate for a 1 week of the year of the Bone and Joint Day for different there is a courses, different public health seminars, and sometimes we distribute in rural areas, we distribute different kinds of medicine
Mm-hmm.
for awareness of the arthritis and osteoporosis. And the awareness program should increase more and more so that the patient can understand what the disease is, and it is not the crippling type of disease. If it is addressed at the early stage and proper treatment is given, then the amount of patient's burden, the amount of disease burden can be reduced.
Mm-hmm.
But the government initiative, I think, is not that is a very less. It should be more and more the government and other organization will take care of the initiative, and the people understanding and
Mm-hmm.
thinking of the disease is increased, then the disease can be controlled.
Right. Thank you, Dr. Ganguly. So, in your opinion, what are some key pain areas that we have for arthritic awareness in India? In my different panels, I have understood about the lack of patient education. What are your views on that?
Yes. So the keynote for this the awareness is the patient education apart is important. Patient lifestyle is very important. Diet
Mm-hmm.
is an important factor, and uh, and the other things, like whenever the disease is occurring, don't neglect the disease, because the in India we have seen that whenever the disease is increasing, they go to the different the quacks, and they take different kinds of drugs unfortunately in this degenerative disease, the steroids sometimes is used, and this causes ultimately damage and progression. So the
Right.
education of the patient can only correct, and it is the best weapon in days to come.
Right. Thank you, Dr. Ganguly. As we move towards the end of this panel discussion, I'd like to pose one last question for Dr. Chinmay. Dr. Chinmay, I hope I'm audible to you. Hello, Dr. Chinmay.
Hello, I
Okay.
cannot hear you properly. Please repeat
Yes.
the question.
Am I audible to you, Dr. Chinmay?
Yeah, right now.
Yes, sir. So
Yeah,
as
yeah,
we
right.
move towards the end of
Yes,
this
yes.
panel discussion, I'd like to ask you one key takeaway, a key take home, and a message that you'd like to give to all the viewers who have engaged with us. Maybe it could be your fellow healthcare peers, could be patients, could be families, could be caregivers. A message that you'd like to give to everyone who's watching this arthritic awareness campaign from your side, Dr. Chinmay, please.
Yeah, the message which I want to give to all my patients of having this chronic pain, sort of things, be it arthritis, be it arthrosis, is that they think that this is like a disease like fever or a short duration of viral infection. We treat the disease and they will be cured and it will not never come back again. But you have to understand that this is the disease which will stay with you, and you have to live with that disease. And whenever I convey this message to my patients, most of the population, they get depressed, but because there is a chronic pain causes depression. So don't get depressed. You have to fight with the disease continuously, and if we follow proper instructions, you can live a fruitful, decent, near normal life, even if you are affected by this chronic arthritis.
Thank you,
It is
Dr.
possible.
Chinmay, for that wonderful message. Moving over, Dr. Ganguly, your key take home and a key message that you would like to impart to all the viewers watching this campaign, please.
So the thing, if you think of yourself, then you will be okay. So taking care of yourself, either by education, either by exercise, either by lifestyle, is the key to prevent the progression of the disease. And because we have seen the patients, the people in the Europe or USA, they are more active at the even at the 80 or 90 years of age. Why we are not? Because this is mostly because lack of education, nothing else. We have everything. If the education is appropriate, if the self care is appropriate, then definitely we can see the disease is gradually reducing. And definitely the fear of the patient, whenever the disease is very progressive, is very advanced disease, the most of the patient fear that the adequate treatment like knee replacement can cause more problem, more harm than not doing it. This is a very wrong message, because the any surgery like knee replacement is a very successful surgery. It makes the patient mobile from the next day or from the same day of the surgery. It reduces the pain instantly. And this has to be, this is the patient education. Because if the patient comes to the surgeon, the yes, I have pain, I have deformity, I am not able to walk, please replace my knee and make me mobile. So that approach from the patient is more needed than the approach from the surgeon. That
Right,
is the
sir.
difference. That is the difference from the outer world country to the third world country like us.
Yes. Thank you, Dr. Ganguly, for that wonderful message. So, with this, I'd like to bring this panel to a closure. I'd like to thank Pfizer for powering this particular arthritic awareness campaign that we are doing. And I'd like to thank all the viewers and my experts, which includes Dr. Chinmay Nath, Dr. Anindya Basu, and Dr. Ritwik Ganguly. Thank you, people, for stepping up with Voice of Healthcare in creating awareness on arthritis. Have a good day, and thanks a lot.
Thank you very much.